From mild to severe, depression symptoms may vary from person to person. Respectively, the treatment approaches will differ. This video tells you the most common treatments for depression. Be sure to watch until the end because you will learn the safest treatment for a pregnant woman with major depression. 1. Lifestyle. Lifestyle changes are the preferred treatment for mild depression. They are also beneficial to moderate and severe cases, combined with medication and psychotherapy. Exercise. Regular exercise can boost serotonin and endorphins and promote a healthy brain. Social support. People with depression are at high risk of isolation. A strong family bond and close contact with friends are beneficial. Support groups and volunteering are other ways of expanding social support. Nutrition. A balanced diet rich in fruits, complex carbohydrates, fat, and protein is essential for your physical and mental health. Sleep. Poor sleep can make depression symptoms worse. Optimal sleep of 7 to 9 hours per night will keep your mood good. Stress reduction. Reconsider your life goals and rebalance priorities. For example, lessening your workload or resolving family issues can reduce stress. Smoking cessation. For depressed smokers, smoking cessation has similar effects as antidepressants. 2. Psychotherapy. Psychotherapy can be effective and integral part of treatment for depression. It can be used alone for mild cases or with medication for more severe or chronic forms of depression. Cognitive behavioral therapy, or CBT, is the most studied form of psychotherapy. It teaches clients to learn cognitive and behavioral skills in combating negative thinking and counterproductive behaviors. Psychoanalysis and psychodynamic therapies resolve unconscious mental conflicts and find the root of depression. They help clients understand what triggers their negative thinking and behavior and teach them ways to live a healthy life. Some specific areas that psychotherapy can help you are: improving relationships. Therapists can help you look into your relationships and find ways to improve them, establishing better social support. Setting healthy boundaries. If you are a person that cannot say no, demands at work or in personal life can be very stressful. Therapists can help you set limits and reduce stress. Handling life's problems. Therapists can guide your response to personal issues in positive ways. 3. Medications. Depression medication is the most well-known treatment for depression. However, it may not be the most effective. The first antidepressant used is only effective in 50 to 75% of cases. It takes at least 6 to 8 weeks to work, and the treatment continues for 16 to 20 weeks, sometimes up to a year. For chronic cases, patients may need to take the medication indefinitely. To find the most effective antidepressants with minimal side effects, your doctor may adjust the dosages and sometimes prescribe different classes of antidepressants. However, antidepressants work best in combination with lifestyle changes and psychotherapy, which helps speed up recovery and prevent a recurrence. Here is a list of medications in the treatment of depression. Selective serotonin in reuptake inhibitors. SNRIs include sertraline brand names Zoloft or Lustrol, escitalopram brand name Lexapro or Cipralex, fluoxetine brand name Prozac, paroxetine brand name Seroxet, and citalopram. They are the primary medications due to their effectiveness and mild side effects. However, they are not recommended for people with sexual dysfunction. Except for fluoxetine, they are not recommended for people under the age of 18. Serotonin in norepinephrine reuptake inhibitor or SNRI. SNRIs include venlafaxine brand name Effexor, desvenlafaxine brand name Pristiq, and duloxetine brand name Cymbalta. They may be more effective than SNRIs. However, doctors usually do not use it as a first-line treatment because of the higher rate of side effects. It is especially not a good option for children and adolescents. Tricyclic antidepressant. TCAs include nortriptyline brand name Pamelor, amitriptyline brand name Elavil, and imipramine brand name Tofranil. TCAs have more side effects than SNRIs but fewer sexual dysfunctions. They are normally used in hospitalized patients. Monominoxidase inhibitors. MAOIs include phenelzine brand name Nardil, tranylcypromine brand name Parnate, and isocarboxazide brand name Marplan. MAOIs were the first antidepressants approved but are rarely used due to life-threatening adverse effects. Norepinephrine and dopamine reuptake inhibitors. Bupropion brand name Wellbutrin is the only member of this drug class. It treats depression and other mental disorders, such as seasonal affective disorder, anxiety, bipolar disorder, and ADHD. Non-competitive N-methyl D-aspartate receptor antagonists. Esketamine brand name Ketanest or Spravato was approved in 2019. It is used together with other oral antidepressants. This nasal spray form of antidepressant increases the risk of suicidal thoughts and behavior. It also is prone to abuse and misuse. It can only be used under a healthcare provider's direct supervision in a certified medical office. Lithium. Lithium can enhance the effects of antidepressants. It also dramatically decreases the suicide risk in recurrent depression. Thyroid hormones. Low-dose thyroid hormone can supplement existing antidepressants for cases that are not effective with multiple courses of medication treatment. 4. Electroconvulsive therapy. Electroconvulsive therapy, or ECT, is a psychiatric treatment in which seizures are electrically induced. ECT is usually used when other treatments of depression are not effective. It is also considered one of the safest treatment options for severely depressed pregnant women. One administration of ECT is effective for about 50% of persistent depression cases. The usual course of ECT involves multiple administrations, typically 2 or 3 times per week. The treatment continues until the person no longer has symptoms. The most common adverse effects are confusion and memory loss. Other treatments. Transcranial magnetic stimulation, or TMS, stimulates small brain regions to relieve depression symptoms. Transcranial direct current stimulation, or TDCS, stimulates small brain regions with a weak electric current to relieve depressive symptoms. Bright light therapy reduces depression symptom severity for people with a seasonal affective disorder or non-seasonal depression. A quick reminder: this video is for information only. Please seek medical advice from appropriate healthcare professionals. If you like the video, give it a thumbs up and share it with your friends. Comment below to share your experience about depression treatments. Please subscribe to our channel. Your support means everything to me.